Hello everyone and welcome to my channel. This is Dr. Tidman. Thank you for taking the time to stop by my channel and view this brief research review. The presentation will be my take on the study article, some of the elements of the study, some of the findings, and some of the conclusions or takeaways from the article. I also always include some tips and takeaways from my own experience as a metabolic health practitioner and working with patients with Parkinson's for well over 45 years. I also have been conducting clinical research in Parkinson's disease since 2018 as the Director of Clinical Research for the Colorado Parkinson Foundation. In my role as a metabolic health practitioner, I try to bring in many areas of health and wellness, lifestyle, and nutrition when I'm working with patients. Thanks again for stopping by my channel. Remember to like, subscribe, and hit the notification bell so that you can be informed of my future videos. I post a brief research review video every Monday. Today I have the pleasure of presenting a brief review of an article by a neurologist and researcher that I greatly admire. Dr. Matt Phillips is a neurologist in New Zealand. He's known as the metabolic neurologist. So check him out. He has a YouTube channel as well. This study, to my understanding, was the first randomized controlled clinical trial in Parkinson's disease, testing the effects of a low-fat diet versus a ketogenic diet on symptoms in Parkinson's disease. In the abstract for the article, the authors discuss the fact that evidence suggests that manipulating the diet or nutritional approaches can influence motor and non-motor symptoms in Parkinson's. There's some conflicting evidence. The authors designed a pilot randomized controlled trial to compare the plausibility, safety, and efficacy of a low-fat diet for one group compared to a ketogenic diet for the other group on patients of Parkinson's that were seen at Waikato Hospital in New Zealand. The authors developed a protocol to support patients, including educational materials, and we're looking at within-group and between-group differences on scales like the UPDRS, the United Parkinson's Disease Rating Scale, which is used widely. The study duration was 8 weeks. So the authors randomized 47 patients, of which 44 started the diets and 38 completed the studies. So they had an 86% completion rate, which for most nutritional studies is pretty good. The ketogenic diet group maintained physiological, or what we call nutritional, ketosis throughout the study period. Briefly, both groups significantly decreased their UPDRS scores, but the ketogenic diet group decreased more in part 1, which is mentation, mood, and behavior, and some of the non-motor symptoms in part 2. The largest between-group differences were observed in the ketogenic group for improved urinary problems, improved pain and other sensations, improved fatigue, improved daytime sleepiness, and improved cognition. There didn't seem to be a lot of differences between the groups for parts 2 to 4. The most common adverse effects were excessive hunger in the low-fat group And in the ketogenic group, they had intermittent problems with tremor and rigidity. What they found was that the ketogenic group and the low-fat group were safe and the diets were effective. There were no adverse reactions. And that both diet groups, or both dietary approaches, should I say, could significantly improve motor symptoms, but that non-motor symptoms improved more in a ketogenic group adopting a low-carb, healthy fat dietary approach. So some of the methods they used in this study: the patients underwent a 2-hour screening visit where the diet plans were presented and they took some baseline medical and social histories. They administered the MOCA, which is a cognitive assessment, because these participants had to have a certain cognitive level to be eligible to participate. And then they collected things like body mass index and calculated the calorie intake for each person. And of course, they obtained written consent, which is required when you're conducting human research. The eligible patients for their study were age 40 to 75. They had to have a Parkinson's diagnosis. Their MOCA score needed to be above 20. They had to have a BMI above 18.5. And they had to be willing to be randomized to either dietary approach. They targeted patients with Parkinson's stages 1 to 3. So stage 0 and stage 5 were excluded. So that would be stages 1 to 4, sorry. They also excluded patients with a psychiatric diagnosis or with a past history of substance abuse. So the patients engaged in an 8-week intervention. During the 8 weeks, they had 4 one-hour clinical visits. So they had lots of education throughout the 8-week period, and the communication was with in-person meetings and via email. A single neurologist assessed all the patients, but was blinded to which group they were in. And so each visit, they took their biomarkers, weight and waist measurements, hemoglobin A1C, triglycerides, HDL, total cholesterol, urate, and C-reactive proteins. So some of these are common metabolic markers that we use, and also some inflammatory lab work. The participants were also given a free blood glucose and ketone meter for both groups, and they monitored their blood ketone and blood glucose levels every morning. The information and education they were given included things like weekly shopping lists and sample menus. And then the researchers were available to the participants for education and answering questions if questions arose. Again, they targeted scores on the UPDRS and their metabolic biomarkers. So 47 patients enrolled, of which 44 started the study and 38 completed the study. So an 86% completion rate is really pretty good. 6 patients withdrew for reasons unrelated to the diets, and 3 patients withdrew because of difficulties with the diets. This is just a sample from the study article. Check it out for yourself. I'll put the description or the link to the article in the description below. But this is just a sample of the blood glucose and ketone readings that the participants took throughout this study. As you would expect, the low-fat, high-carb group had high glucose but lower ketones. And the ketogenic group, as you would expect, had lower glucose and higher ketone levels. Both diet groups significantly improved their scores. We've talked about this. The average patient in each group lost between 4 and 5 kilograms. Both groups improved in part 1 scores, but the ketogenic group improved more. So the ketogenic group in part 1 had a 41% reduction in their baseline scores, 41% improvement, whereas the low-fat group had an 11% improvement in their part 1 scores. So the authors recognized the limitations of their study. First, it was a small study population, and a larger sample size is needed to make any kind of comment or generalizing these results. Secondly, there were 9 patient withdrawals due to different reasons, so this might have skewed the results. And so these results, according to the authors, need to be viewed as preliminary. This pilot randomized controlled clinical trial shows that modified diets based on available ingredients and whole foods with normal protein levels are plausible and safe, and they can be used as treatment approaches in Parkinson's, with the ketogenic diet leading to greater improvements in many of the more disabling symptoms that L-DOPA medications don't usually account for. It's possible, they conclude, that a ketogenic diet could play a complementary role alongside L-DOPA treatment in the treatment of Parkinson's symptoms, and I agree with that. So, Dr. Tidman's tips and takeaways based on the article. These should be very familiar to you if you have watched some of my videos on my channel. I would recommend you adopt either a low-fat or a high-fat ketogenic diet. A low-fat diet, yes, that's high in carbohydrates, can influence your motor symptoms if you concentrate on whole foods and non-processed foods. However, keep in mind that the high-fat ketogenic diet approach in this study yielded more significant results. When you adopt a low-carb, healthy fat ketogenic diet, it raises the beta-hydroxybutyrate levels in your blood, we call them ketones, and that persons with Parkinson's who can raise their ketones above 1.0 millimolar can sometimes impact their cognition, sleep, anxiety, depression, motivation, mood, and behaviors, which are mostly non-motor symptoms. I would recommend you use a food tracking app to make your dietary adjustments and track your therapeutic carbohydrate reduction. I also would recommend you get a blood ketone and glucose meter and test your blood ketones and glucose every morning while fasting. It's very helpful to adopt an intermittent fasting regimen where you take your meals down to 2 meals a day and fast for 16 hours overnight. Or occasionally, maybe once or twice a month, adopt a 1 meal a day fasting regimen where you're fasting for 20 hours. These fasting protocols significantly raise the ketone levels in your bloodstream. Another method to raise your ketone levels, of course, is to add daily MCT oil between 3 and 5 tablespoons per day. The current study that I'm recruiting for is implementing this protocol to see the effects on blood ketones and then to note any effects on symptoms of Parkinson's disease. Work with your doctor to regulate your dopamine medications, because sometimes we find that once patients start reducing their glucose and elevating their ketones, the need for dopamine medication changes, and those doses can sometimes be reduced. This is the reference to the Phillips et al. Research article that's linked in the description. And this is the article information in terms of the contact information. Again, thank you for checking out my YouTube channel and for viewing this brief research review. Remember to like and subscribe and hit the notifications so you'll be informed of my future posted videos. As a reminder, I'm posting brief research reviews every Monday. Take care, everyone.